Welcome, everybody. Thank you for joining today's webinar, the second in a multi-part series on artificial intelligence hosted by Axxess. Hi, my name is Deborah Hoyt, Axxess' Senior Vice President of Public Policy, and it's my pleasure to serve as today's moderator. Over the course of this series, we've been exploring how AI is reshaping home-based care, from fundamentals and governance to solving real-world challenges in your clinical, financial, and operational business areas. Today's conversation sits at the intersection of policy, compliance, and innovation. As we explore the 3 R's, requirements, regulations, and roadmap, you'll gain insight from our expert panel to ensure your organization leads with foresight and from a position where you can mitigate risk and align these emerging technologies with your mission-driven care. So now it's my pleasure to introduce our 2 Axxess panelists. Christina Betanzos, she's General Counsel, and Arlene Maxim, Senior Vice President of Clinical Services. Welcome, ladies.
Thank you, Deb.
Thank you.
Hi, Arlene. Hi, Christina. Well, we have a lot to talk about today, but Christina, before we dive in, let's do a brief recap of the first Axxess webinar in our series, which covered fundamentals and governance. Could you share just a few highlights to give us a foundation for today's discussion?
I'd love to. Thanks, Deb. The first webinar was both interesting and informative. And if you couldn't attend, you should try to watch it on the Axxess YouTube channel after this discussion. It explained how AI is transforming home-based care by reducing administrative burdens and enabling smarter, more adaptive tools. Axxess Chief Technology Officer Andrew Alowu distinguished basic task automation, which are more assistive in nature, from advanced machine learning systems like generative AI. These are some of the tools that can personalize care, predict outcomes, and empower providers to fully unlock AI's potential. He even highlighted a few of his favorite Axxess intelligence tools, like Ask Axxess and the Axxess Care Provider Predictor. And Chief Operating Officer Tom Codd emphasized the importance of governance and risk management and ethical policies. Overall, the message was clear. Responsible, well-governed AI can improve efficiency, compliance, and most importantly, the quality of patient care.
Perfect. Thanks, Christina. We're going to build on that in a lot of ways today, so I'm very excited about our conversation. One thing that I did want to tell our viewers is that as we move through today's conversation, just a reminder that our expert panelists' comments are for your educational purposes, and they do not constitute legal advice about your organization's specific use of artificial intelligence. So, good afternoon, Arlene. Let's begin with you. AI has great promise, but also regulatory complexity. What specific compliance or regulatory requirements, whether from CMS, state agencies, or accrediting bodies, should organizations be aware of as they begin integrating artificial intelligence into their clinical or operational workflows?
Well, that's a really good question, Deb. And we're such at an infancy stage right now that we don't have a lot of regulations that we're concerned about. However, the regulations we do have will have impact on AI. So earlier this year, CMS presented an RFI, a request for information, to the accrediting bodies and to all healthcare leaders, and asking, they want to explore some parameters that they might take a look at to put some parameters on what they're going to be looking for in AI. The accrediting bodies did not get any response from CMS yet. However, the Medicare Advantage plans did get a lot of response, and that's really where they focus. So right now, they haven't impacted us a lot yet. So there's really not a single comprehensive regulatory oversight specifically on AI that exists like right now. So the oversight that we're going to see now and in the near future are going to be with the existing statutes that we already have. So the conditions of participation, Medicare policy, and that type of thing. Some of the state organizations, and I know Christina's going to cover that, do have some requirements we're going to have to be concerned about. But CMS and the FDA guidance have been evolving within those state parameters and those requirements that they're going to have. There's 5 things that I think if folks that are listening, you might want to write this down. 5 things that we know are going to impact our own policies and the way we function within AI. And the first one is patient safety. Of course, patient safety is always on the top of our list of anything that we do, but that is going to be something they'll be looking at very, very carefully, because there can be, with hallucinations with it, and we'll talk about that a little bit later, but with the hallucinations within the AI process, there's a very good chance that we could have patient safety impacted on that. They want to make sure that there's mitigation of bias. That's another thing that we'll talk about a little later. That's another piece of terminology that might be not familiar to some of the clinicians. But the mitigation of bias, making sure that AI sees things the same way we do, and they don't. They don't always. That doesn't always happen. Transparency within your clinical record, within your policies and that type of thing. Number 4 is data privacy, making sure, because this is going to be very interesting to see how this works out. I've actually gone into some of the chat rooms, some of the chat, like Chat GPT and that type of thing. I see people's names in there every once in a while. So there is a chance that data privacy could be risked there, as well as in other parts of our business while we're using AI. And then the last thing to make sure you're covering is clinical accountability, and making sure that your clinicians understand how to use AI, they're following your policies, they're staying up to date. Things are going to be evolving very, very quickly. And I think Christina will agree as she goes through her presentations that we're going to see probably a lot of regulation coming through in the next 5 years. Things, like I said, we're in the infancy stage now, and I think things are going to evolve very, very quickly. So they do have some algorithms that they're working on right now with coverage determinations. And for those of you who have studied, as I have for many years, the Medicare Policy Manual, one of those favorite reading pieces of material, you know that there's something in there called rules of thumb. Which means that CMS cannot determine whether or not something should be covered based on rules of thumb. What one patient does not look the same as the other, not necessarily look the same as the other. And so they have to look at the clinical documentation to make those determinations. It's going to be the same thing with AI. They're not going to be able to use rules of thumb. So we're going to have to be very, very careful that our documentation supports individualized care plans, so that those types of things and the algorithms are going to reflect what's actually being done within the clinical aspect of home health and documentation.
Thank you, Arlene. Yeah, you're talking about AI and its applicability in home-based care being in its infancy. I know Christina wants to talk a little bit about, the regulatory framework at both the state and federal levels related to AI. So Christina, you're legal counsel. You've got a lot of insight into what's happening on the state and federal level in terms of the laws. Arlene, on the regulatory side, it's kind of a nice marriage in terms of the information you can pull together here. So Christina, what are your thoughts around the federal and state situation?
Thank you, Deb. The best way to describe the current regulatory landscape is a patchwork of laws. It's at times focused on a specific area of concern, like deepfakes and chatbots, and at other times focused on transparency and consumer protection. But right now, there is no comprehensive federal law governing artificial intelligence. There are sector-specific laws, think HIPAA, Title VII, the Federal Trade Act. To give you a sense for this, agencies like the FTC are using existing laws to combat false and deceptive marketing of AI, sometimes referred to as AI washing, where a company exaggerates the extent of artificial intelligence in its products or services in an effort to appear more innovative. And although there's no federal law, the current administration does seem to be moving toward an emphasis on innovation in an effort to accelerate AI development. President Trump has issued a number of executive orders and an action plan focusing on deregulation. And for some breaking news, yesterday, the president urged state legislatures to rein in AI laws and for Congress to consider passing a bill that would effectively ban state AI regulations, citing the need for one federal standard. But even with this call to action, it's important to understand where we are currently in terms of AI laws. Most of this is happening at the state level. In 2025 alone, states have introduced over 1,000 pieces of legislation. This sounds like a lot, and it is, but just over 100 of these were actually signed into law. And it does show just how active states are being in the area of AI. But not all of these laws will apply to this audience. I thought we would focus on a few of the state laws that relate to healthcare. For context, over 20 states have AI laws that specifically relate to healthcare, and only one has passed a comprehensive AI law, like the EU, and that's in Colorado. So let's talk about New York. New York was the first state to have an AI companion law, which requires clear disclosures and safety measures when interacting with an AI chatbot. As we all know, AI chatbots are becoming more and more common. In fact, I read a New York Times article on Monday that said that 1 in 6 adults regularly consult an AI bot for medical information, citing the convenience, cost, and general agreeableness of the chatbot as reasons why. California has a similar AI companion law that goes into effect at the first part of next year. And in fact, right now, California has a lot of AI laws related to healthcare, at least 6 on the books, related to transparency, disclaimers for parent-patient communications, and prohibitions on AI making medical decisions, just to name a few. As you can tell, California has been quite active in this area. Nevada and Illinois have passed laws which prohibit certain uses of AI in the mental health context, and several other states have passed laws that effectively limit how insurers can use AI to deny coverage for medical care. Texas has also been a leader in this area. It passed a law, Senate Bill 1188, which imposes obligations on healthcare practitioners and some third-party providers. A few key points from this law are worth mentioning. First, it requires data localization, meaning that all electronic health records for Texas residents must be located in the United States by January 1st. Also, this law allows practitioners to use AI in diagnosis and treatment, but only under specific conditions. The practitioner must act within the scope of their license. They must use AI. If they use AI, it must be disclosed to the patient. And finally, the practitioner must review any AI-generated records to ensure that they meet the standards set by the Texas Medical Board. This means there must be human oversight. Many of these laws were passed in 2025 and will become effective next year, but some are already in effect. And the penalties can range from fines and sanctions to license revocations and civil lawsuits. But how do you know which of these AI laws apply to your company? You might want to consider where your business is located, where are your patients, what services do you provide, and how do you use AI within your organization? The takeaway here is that state regulators are not waiting for Congress, and it's up to you to make sure you're complying with this ever-evolving landscape of laws.
Thank you, Christina. Your guidance sets up the need to touch on the most pressing public policy priorities currently shaping the future of care at home delivery, specifically those that our audience should be tracking when evaluating AI solutions, because we know that they're looking at them right now and some are implementing them. And there's a lot of gray areas still around all of this, as you're explaining. So the 3 top public policy aspects around home-based care are the expansion of value-based care and home health value-based purchasing. We know that's been coming and it's in place, but AI applicability to it is going to change that landscape. Also, the shifts in Medicare Advantage and Medicaid reimbursement models. We're not sure how that's going to be intersecting with AI, but we know that that's definitely going to be impacted as well. And thirdly, interoperability requirements and mandates for health IT systems. So with the increasing need for AI to support care coordination, outcomes measurement, and predictive analytics in line with CMS policy goals, the takeaway for providers would be that they must evaluate AI through a policy lens in terms of how it supports compliance, quality metrics, and reimbursement eligibility. So Arlene, can you help us expand on that a little bit? As AI becomes more embedded in care delivery and documentation, and that's your area of expertise, how are accrediting agencies adapting their survey processes? And what proactive strategies can providers use to ensure survey readiness in this evolving environment?
Well, as I mentioned earlier, the accrediting bodies haven't gotten a lot of direction yet from CMS. That will be coming. That's not that it's never going to happen, because we know when anything changes, especially something as dramatic as AI, CMS is going to be right in the middle of it, and they're going to be making policy changes. But so they haven't done a lot of adaptation yet. The guidance to the accrediting bodies right now is simply to assure that the author of the document, like Christina mentioned, can edit and make necessary changes. So they're looking to make sure that whatever system you're using, such as Axxess, that you are able to go in there, and if AI is included at all, there can be human intervention and those changes can be made. I think that organizations need to be really careful about HIPAA and data privacy, especially if they have business associate agreements. It's not just us, but it's anything that's going to impact, like you said, the interoperability piece of this, anything that's going to impact our own documentation. We have to make sure that those folks have AI policies that are as strong as what we want them to have. So the HHS is increasing the scrutiny of the algorithm biases. Christina mentioned the MA plans, the managed care organizations. Those are going to be under a lot of scrutiny. And some of what we'll see too is civil rights getting involved, because they're going to want to see, I mentioned bias in another way, but they're going to want to see if there's any bias in the types of patients that we admit, the types of diagnoses, the ethnic background, all that type of thing. So civil rights will get involved in this, and they'll have algorithms that will be able to tell them. So, if you think about that, having the ability for the government to have insight based on pure numbers, and they can break it down to the individual agency, they'll be able to clearly see if we are out of compliance in a lot of different areas. So I think that the accrediting bodies will use a lot of that information. The one tip that I would give everyone, like I do in my Maxim memos, I try to give tips every time I present a topic. Make sure that you have an interdisciplinary governance committee within your organization. And the best place to do that, as far as I'm concerned, is within your QAPI program. I think that's probably one of the best ways you can oversee what's going on. Again, you're looking at documentation anyway, you're looking at statistical information, you're looking at patient safety issues, all those things I went over earlier. So your QAPI program should include that governance, so that you have ongoing monitoring to make sure that you've got adequate training. That's where you're going to be able to see that you have to do more training with your staff. And this is not going to be an easy thing to do, I don't think. I think that AI is going to be more difficult for some nurses. We've had a lot of the nurses are still the baby boomer area of nursing. We still have a lot of baby boomer nurses out there, and they're going to be leaving soon. However, we're going to be depending on them. There's a lot of retired nurses that are coming out of retirement to help fill the gaps that we have now. AI is going to be tough for them. If it isn't already. They did not like computerization. I remember when Oasis started, they hated Oasis. When we went to EMRs, they hated the EMR. So AI is just going to be one of those other hurdles that we're going to have to overcome. And so clinical training is going to be have to be top of mind. I know the Axxess training certification program is going to include a lot of AI information, and we'll be able to educate on via the training certification program. And so stay tuned for some of that. But we also have to make sure that we're documenting the rationale behind our decisions and what type of training we're going to be doing with the staff, what kind of documentation, even what type of EMR. Make sure that if you're not using Axxess, we know that Axxess is solid as far as the AI is concerned, but if you're not using Axxess, make sure that you have, you're working with a program, that an EMR program that is just in tune with AI and the requirements and the places you might have problems, as you possibly can. Make very sure that it's compliant with everything that needs to be compliant with.
Thank you, Arlene. You know, one thing that you mentioned was this interdisciplinary governance team within organizations. And Tom Codd and Andrew Olohu mentioned that in the first webinar of this AI series. And I think the things that I'm hearing from you and Christina right now are AI, artificial intelligence incorporation into a home-based care provider organization has implications at all levels, right? For the CEO, for the leaders, for the risk management team, for clinicians, for the in-office team, for the quality folks. And this webinar and our webinars that will be coming up over the next several months are going to be a good introduction to that. But I think they really need some deep dives, and there's going to be an opportunity actually next May 2026. The preeminent technology and AI conference is the one that Axxess will be hosting, called Agile. If you haven't heard about it, it's the Axxess Growth, Innovation, and Leadership Experience, and it takes place in Dallas. There's going to be deep dives for the clinicians, the quality folks, and those people on the ground within the organization, but also a breakout leadership summit for the CEOs and C-suite folks who really need to understand this, and make sure that, their compliance is very tight, because this is really going to, it can open up all kinds of risks, as Christina mentioned earlier. So hopefully people will be able to join us for Agile so that their entire team can learn more about AI and the technology that's driving Axxess in terms of what we're doing. But there will be a QR code for those of you that may be interested in registering or learning more about the conference in May. There will be a QR code posted at the end of this session, or you can go to axxess.com/agile to learn more about the conference. It's going to be really an interesting opportunity for all of us to be continuing to learn together. So thank you so much for mentioning that. Christina, given the dynamic regulatory environment that Arlene just discussed, what are some practical compliance strategies that providers can use to reduce the organizational risk while still innovating responsibly with AI as it's evolving?
Great question, Deb. The strategies that I might consider are, first, performing an audit. Every company should have an inventory where they currently use AI in their business and how their employees are using it. This inventory can be a living, breathing catalog of AI tools that can be modified as necessary. Once you have this list, you should consider categorizing each AI tool as low, medium, or high risk. And the risk levels may depend on a few different factors, one being whether PHI is involved. Now, much of our industry is focused on PHI, as it should. But there's also a risk. It puts confidential if an employee confidential information into a public platform. Arlene touched on this, I think, in the first question. But think about patient lists, financial and pricing information, marketing strategies, and referral sources. An employee may innocently use ChatGPT to prove an internal memo or agenda, but it could become quite detrimental to your business if this information is exposed. Another issue to be aware of is that your employees may not be telling you everything. A concept called shadow AI describes when your employees are using AI without your knowledge, or maybe even in violation of a company policy. And this can pose significant risks as well. So, having an open, honest conversation about AI, establishing clear guidelines, and providing ongoing staff training, I think Arlene mentioned that too, may help to mitigate this risk. The second recommendation that I would have is something that my colleagues in the first webinar mentioned, and that's to have a dynamic governance framework, which includes policies, practices that will guide your business in the responsible deployment, use, and management of AI. But who should be involved in managing the ongoing governance at your company? If you're a small company, you may be thinking, what should I do here? But you can appoint a compliance officer. If you're a larger company, you may already have this interdisciplinary team, but if not, create a cross-functional team of key stakeholders to evaluate and monitor AI tools and to perform internal audits periodically. But this should really be scaled for the size and complexity of your organization. So when you're considering deploying an AI tool, your officer or team should probably consider, what benefit will this tool provide? Do I need to disclose it? Is the data protected? And what does success look like? Partnering with a trusted vendor like Axxess that's really at the forefront of AI development and compliance can reduce the strain on your business. You also need to pay attention to employees that freely adopt new AI tools. There could be a risk that they begin to over-rely on that AI tool. This is called automation bias, where your employees begin to trust the results a little too much. As a result, many of the laws I previously mentioned focus on a need for human oversight. You simply cannot delegate your professional judgment in this way. And then finally, I would recommend putting some practical guardrails in place. We've said it a couple of different times, but having that compliance officer or team can serve as a critical check on both risk and compliance when adopting a new AI tool. Clearly communicating your company's policies, practices, and expectations around AI, specifically having an acceptable use policy, so your employees know which AI tools are permitted and the parameters for using them. I'd also recommend doing routine spot checks of AI-generated records to ensure that there is meaningful human oversight. And then finally, staying up to date with AI laws. This one might be a little tricky. And I was going to recommend that as the number of state laws increases, so do the risks and challenges of compliance. Due to President Trump's comments just yesterday, we may want to be on the lookout for new federal legislation that would either limit or ban state AI regulations. But in the meantime, to stay abreast of these changes, there are several organizations that actually provide trackers for state AI laws, including the International Association of Privacy Professionals and the National Conference of State Legislatures. Just know that as your trusted partner, we are navigating this right along with you.
Thank you, Christina. That was very helpful, particularly those two websites. And I think that maybe we could put those in the chat as well to make sure that people can reference back to them. So thank you. That was very interesting. I'm going to move back to Arlene. The title of this webinar was Regulations, Requirements, and Roadmap. So let's turn to the roadmap piece of it. So Arlene, developing a policy-informed roadmap for AI adoption can feel overwhelming for our listeners, for the people that are in the home care industry. What key elements should be included in a strategic roadmap that aligns AI deployment with long-term business and care delivery goals?
Well, thank you, Deb, for asking that. And thank you, Christina, for bringing up the compliance officer. I left that out of my presentation completely, but that's one of the most important people that you're going to have in your organization when you're dealing with AI. So, your compliance officer should be part of that FLOPPY program that I mentioned earlier. So there's 5 things, Deb, that I would recommend for organizations to be looking at. So these are 5 more things you might want to write down as we're doing this webinar. So one of the things is to identify the right problems within your organization, and what are your future goals for AI? What do you want it to actually do for you? Now, some of the smaller organizations may not get into AI as much as the larger organizations, but Christina is absolutely right. They have to make sure that we have really good policies that keep things in check and that we have guardrails built around them. So we have challenges every single day. The biggest challenge right now, of course, is workforce management, right? So we want to make sure that we have if we're using AI, use it to the best of our ability and use it in a way that is going to help with the workforce management issue rather than to make it worse. As I mentioned to you, like with the older nurses, they're going to be somewhat, they may be, I guess I can't guarantee that, but they may be somewhat resistant to the use of AI. But making sure that they are they're educated on it, that they're competent in understanding AI and how to use it. It might actually allow them to feel a little more relaxed when they're doing their documentation. It's not so difficult. So of course the documentation burden has always been an issue. I can remember, I've been doing this for a whole bunch of years, and even when we were doing handwritten documentation, it was a big deal. And that's one of the reasons clinicians would leave. AI is going to be able to help with that. So that documentation burden is going to be relieved with AI if we use it properly. Referral delays are going to, if you're having referral delays, they can be reduced by, there are a number of AI solutions out there already that you might want to take a look at. But so you want to make sure that this is you have a long-term organizational goals. You're going to have better outcomes. You're going to have stronger compliance because of it. And you're going to have sustainable staffing models if you use it correctly. But identifying what your problems are and what your future goals are is going to be the key to that. The second thing I would recommend that you do is to assess the data readiness and what kind of infrastructure you have already. So many of the EMRs already have, well, they all do have Oasis E1 built into it, but the quality data and the benchmarking and that type of thing, I know that we at Axxess, we've done a tremendous amount of work on getting benchmarking included in our EMR, and I think it's probably second to none. And so you want to take a look at that, but making sure that you have an EMR that's addressing that data quality. HIS, not HAS anymore, it's Hope accuracy if you're using, if you're in hospice, and then any kind of gaps that you have with the hospital and getting referrals and that type of thing. So you want to make sure that your data is standardized, it's governed, it's continually improving, as Christina mentioned, and that you have AI tools that you're using that are good for your company, not just something that had a good salesperson that tried to sell you a tool. So the third thing in the roadmap is to integrate your AI into your workflows and without disrupting care. So you want to make sure that you've got real-time visit documentation support, you've got predictive alerts for hospitalization risks. Those are so important because that's one of the things we get measured for value-based purchasing on. So we want to make sure that we are determining what patients are at risk and how to generate a care plan that's going to keep that patient out of the hospital. And then any kind of pre-populated hospice research summaries can be done through AI. Those are going to be very helpful for hospice and with this new change to Hope. But your end goal here is that you have more patient time and less clerical time. And that's what we all hope for. And that's been the amount of time we've spent on documentation the past number of years has just been very, very difficult for everyone. And even the poor QA people having to go through that. So I think that the AI is really going to expedite some of that, and so that we are going to have more time to focus on real patient care issues and improve our patient outcomes so that we can get that 5% bonus at the end of the year. The fourth thing I would recommend is to, like Christina mentioned and I mentioned earlier, is to strengthen your education. I cannot tell you how important it is to be signed up with Axxess training certification, because we're going to do a dynamite job of making sure your staff are ready for AI and they really understand it. There's going to be change management involved in this. And with change management, there's always going to be disruption within your organization. So you want to make sure that your clinicians have the AI literacy. And not only your clinicians, but you're going to have to start finding out from your patients and their families what kind of literacy they have as far as AI, because that can be very impactful when you have caregivers that are left to take care of their family members. There's a lot of information online about taking care of patients, but you're going to have to understand how to use it and how to get into the AI in order to access that. So then the last thing I would recommend is to, and I've already recommended this, and so is Christina, is to establish your governance, your compliance, and then continuously evaluate that. So you want to make sure that you have a reduced time and the time it takes to write actual clinical notes and assessments. That'll be something you'll be able to measure. Making sure that you've got accuracy in hospice eligibility documentation, that you are lowering your looper risk. AI can help you tremendously with that. And then improve your patient or your clinician satisfaction, well, your patient satisfaction too, but your clinician satisfaction for sure. So your roadmap should include all of these things. And if you get all of these things put together and get them in a nice firm policy, and as we've both said throughout here, we don't have a lot of direction yet. And with if some of the direction is taken away from us in some of the states, well, then you're going to have to use some really good common sense and some really good critical thinking skills to make sure that you have this all put together. But AI is the future. 5 years from now, when we do this, it's going to look the same type of webinar series. It's going to look a whole lot different than it does today. And but it's encouraging. It's encouraging. It's going to help staff spend less time on paper and more time with their patients and better outcomes.
Thank you so much, Arlene, for that. And that's the goal, right? Better outcomes and less time on paperwork and documentation. So I thought that was a very clear roadmap, 5 really solid processes that people could start thinking about or adopting now. So thank you for that. Let's move back to Christina. Christina, we always hear that we often hear that success in AI isn't just about the technology, it's about alignment, right? How can leaders ensure that people, processes, and technology are truly integrated to drive sustainable outcomes in home health and hospice care?
Yeah, thank you, Deb. I think that we are going to beat the AI roadmap drum. And that's because in terms of alignment, I think an AI roadmap is a great place to start. Foundationally, this would be based on having a clear vision of how AI can support your business's strategic, operational, and financial goals. As we've said a couple of different times, including a formal governance framework, which defines responsible innovation at your company. Rather than jumping into the deep end, you may want to start with projects that address your pain points or projects that offer a clear ROI. Additionally, I would recommend promoting the roadmap cross-functionally, and I think that will help with adoption across your organization. But the real key here is clear communication. Transparency around your processes and the use of AI tools is critical to earning the trust of your staff and your employees internally and with your clients and patients externally. Additionally, I would recommend being flexible. The technology and the laws around AI are evolving rapidly, and companies that are willing to adapt will have a greater likelihood of long-term success.
Thank you, Christina. You mentioned that, as organizations start their AI compliance journey, that they have to start small or pick one project. But we've heard so much from you and Arlene. Is there one last comment that you'd like to leave them with in terms of some more advice?
Yeah, absolutely. All right. So if I had to give one piece of advice for people starting their AI compliance journey, I would say to embrace the technology. Artificial intelligence is inevitable. It's reshaping how care at home is being delivered. And you may have concerns, you may have some fears, but with the proper guardrails and a trusted partner, AI is a tool that can save you time, improve your performance, and really keep you from being left behind. One of the most valuable currencies we all have is time, and there's a huge opportunity to streamline your operations, saving you and your staff time and money. The stakes are high in this industry, so think of AI as a college intern, a teenager. They have a lot of potential. They can be a lot of help, but they still need guidance and oversight.
That's a great analogy. So as we begin to wrap up this conversation, I think what I'm hearing from Christina and Arlene is that it's critical for organizational leaders to be watching key policy shifts and emerging regulations so that they can begin preparing today. There's so much that's still fluid in the industry, but there's a few things that we do know. So there might be possible CMS AI oversight frameworks, for example, audits or documentation standards coming. Secondly, an increasing push for compliance with interoperability partners. So make sure that you're in contact with your Axxess representative, making sure that we're fully aligned with everything you're trying to do, and you can leverage Axxess Intelligence for so much of this to get you started. And thirdly, compliance with the patchwork of state laws and emerging federal guidance. We just heard from Christina today that President Trump is talking about maybe not allowing states to drive this, but perhaps the federal government, which would allow us to have a more universal framework, something a little bit more easy to understand. But that's all to come. We're not really sure how that's going to play out. So we are interested in continuing to educate you on all of this. And a reminder of preparation strategies that Arlene and Christina also recommended. One is become active members of your advocacy associations, like the National Alliance for Care at Home and your state home care and hospice associations. They oftentimes put out a weekly newsletter, and they're putting all kinds of new information about what's happening at the state and federal level, and may be able to keep you updated on AI policy within your specific geographic service area. Christina also mentioned those two other websites, and we'll make sure that we post them in the chat for you. And then lastly, create a solid governance framework with the goal of conducting ongoing internal policy reviews, making sure that your interdisciplinary AI team within your organization is really on top of everything that's happening. We'll make sure that we keep you up to date on that as well. And then lastly, some key takeaways that I heard today is having a solid framework to ensure your team monitors the use of AI, doesn't become too dependent upon it, and always incorporates human oversight to ensure clinical integrity. That is going to be one of the main pieces, I think, that we're going to be seeing as we move into the future. So I just want to take a moment to thank Christina Betanzos and Arlene Maxim for sharing your expertise. I'm so fortunate to have these two colleagues. I think that legal, regulatory, and policy all work together in a way that's helping us all begin to understand this so that we can share all this good information with you. And a reminder to all of you that are watching today that this is the second in a series of webinars in Axxess's Artificial Intelligence series. Be sure to join us for our next webinar in just a few weeks on December 2nd, and it will be entitled Driving Operational Efficiency with Axxess Intelligence. So on behalf of Axxess, thank you for joining us today. We look forward to continuing this journey with you in the coming months and into 2026. Have a wonderful afternoon.
Thank you for joining Axxess On Demand. Visit axxess.com for more on-demand videos, industry resources, blogs, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.